Hey guys, Jim Hoffman here from turbomedic.com, and today I want to talk to you about something that we'll see a lot in EMS, and that is syncope, or those patients that are passing out. You might have heard family members or bystanders say, well, one minute they were just standing there talking to me, and the next minute they're unconscious. And the simple truth about people that pass out, basically, if you think about it, our bodies do everything for us. When we stand up, they have this whole system in place that's working to keep us upright. Body sensors that are working like little alarm systems, nerves telling our blood vessels what to do, blood vessels actually doing their thing of either squeezing or not squeezing. And then, of course, the right amount of fluid in the body going where it has to go to keep everything running nice and smooth. But the thing is, when people get older, which is a lot of what we see in EMS, this system I'm talking about starts to get a little less effective, and these things don't really work out as smoothly as they usually would anymore. So things that break down are those body sensors I mentioned start getting slower. The blood vessels don't squeeze as hard. Leg muscles can start getting weak, and your body even starts running low on fluids. And as a sidebar, something that's kind of interesting to note is that about 1 in 3 people you encounter that pass out are going to be happening because of usually two main causes of it. One of them is going to be the vasovagal issue. They're passing out from fear or pain, or maybe they strained too hard, okay? Or an orthostatic hypotensive issue, where the blood pressure is dropping when they stand up too fast. Right? They're laying in bed all night, they get up, they pass out. They go to the bathroom, they're sitting on the commode too long, they stand up, they pass out, things like that. But there's some other things that you need to look out for with people that have passed out, and some things that might make it a little bit more likely that they're going to pass out. One is, like I mentioned, that fluid issue before, right? If they're low on fluids, they've been dehydrated, maybe they've been vomiting or have had diarrhea for a few days. Maybe some of the medications they're taking aren't working the way they should. Blood pressure medications, beta blockers, even alcohol consumption can play a role as well. And they might, when you're doing your history taking, might find out they have a problem with their adrenal glands, or they might have kidney issues, or even tell you that they have Parkinson's disease. So keep all this in mind when you get that next call of somebody that might have passed out or had a syncopal episode, okay? These are all kind of come into play when you're doing your patient history, you're doing the patient assessment. Now, if you're looking for a bigger breakdown on syncope, I have some detailed information inside TurboMedic that covers your assessment, your treatment, your documentation of all this. And you can grab a free access to the insider level at TurboMedic by going to myturbomedic.com. And you can really kind of level up your game when it comes to treating patients and assessing patients who might have had a syncopal episode. Now, finally, guys, if you know somebody who could use this information and this video might help them, go ahead and share it with them and let them know that there's some tips they should be thinking about on their next call of somebody that might have had a syncopal episode. Okay, that's it for me, guys. I'm Jim Hoffman from turbomedic.com. As always, stay safe.